Hello, everybody. My name is Andres Avila, and with my partner, Jason Parra Prieto, we are doing a class project on early detection of brain tumors through image classification in CT scans. So, a little bit of a background with brain tumors. They're one of the most aggressive forms of cancer, impacting many lives within a short amount of time. And there also have been a lot of improvements which in understanding or reducing further complications through the use of CT scans. While CT scans are actually helpful in detecting brain tumors, they're time consuming and difficult, which can be prone to error and variability in image processing. And with the use of machine learning, we want to ask the question of how accurate and trustworthy can machine learning and AI be for image classification and identifying early signs of a brain tumor through CT scans. Now, for literature reviews, a lot of articles have shown recent advances and progress in deep learning models when diagnosing brain tumors and even the accuracy rates. It has helped the healthcare industry progress in diagnosing patients and advancing treatment options in a short amount of time, but the constant limitations are the training datasets, such as not having enough images to diagnose brain tumors or even having different types of images, such as MRI scans, for example. But while that is a limitation, there is a lot of promising results that shows how machine learning is helpful towards helping healthcare professionals. And to answer the question, the analysis was done in four parts. So we first did the data acquisition and pre-processing, which was basically adjusting and filtering images to make sure it is applicable towards the models. We extracted features and also did a model similar to the correlation learning mechanism to understand the classification confidence and improve the feature relevance. We also detected and classified images using a size-aware loss function and understand the framework of the CLM equivalent to understand the tumors in the images. And finally, we analyzed what factors impacted the most and interpreted accuracy results throughout the model.
Hi, on this slide you can see the results of the preprocessing pipeline. The preprocessing allows us to isolate and highlight the tumor regions much more clearly. Here you can see the three key stages: the original image, which contains a raw CT scan with all the surrounding structures; the brain structure versions, where we remove the skull and all brain tissue to reduce noise; and finally the zoom-in detail view, which highlights the tumor regions and provide a model with a clean and clinical relevant area to focus on that, improving the quality on the inputs and made a downstream learning task much more reliable. Next, we show the model's learning performance. On the left, we have the training and validation loss. The important point here is the training and validation loss remain very close, which means we are not overfitting the model. And on the right, we have the training and validation accuracy. Overall, the training curves indicate a strong convergence, very low final loss, and consistently high accuracy. The detection training loss graph shows no significant gap between the training and validation loss, indicating no overfitting. And the detection accuracy graph, the model shows that learns quickly and generalizes where to on-site validation data. Here we summarize the performance of the model, first looking at the confusion matrix. We had 9 false positive and 3 false negative, which is a very small error rate. The raw curve is very close on the top of the left corner, and our AUC score is 0.998, indicating nearly perfect discrimination between the tumor and normal CT scans. The performance table shows us an accuracy of 98.8, precision of 98.6, recall from 99.5, F1 score from 0.99, and a PR AUC 0.99. In overall, the model performs extremely well, achieving over 90% accuracy across the experiment. It's reliable, detecting large and clearly defined tumors. However, it struggles with small lesions, which are the most challenging but also most critical from early diagnosis. We used Sharp to interpret the model's prediction while helping explain the model decision making. Our GradCam methods did not highlight the tumor regions effectively, that's why we don't show it. So while the model is strong for general tumor detection, improve the ability to detect small and subabnormalities remains an important area for improvement. In summary, our framework demonstrates that the machine learning can accurately classify the CT scan and support the tumor detection with very high performance, but early stage detections where the model needs improvement for future works, and we should explore better augmentation for small lesions, more diverse training data, improve the loss function, and refine detection thresholds. Thank you for your attention.